Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be going over health maintenance concepts. Now, before we get started, as always, I'm going to ask you to please support me and support this channel. How? Like this video, you're going to love it. Go ahead and press that thumbs up button now so you don't forget. Subscribe to my channel if you haven't done so already, and press that red notification bell so you'll be notified every single time a new video is released. Don't forget, I'm now offering next generation NCLEX reviews. I'm offering one-on-one consultation sessions and tutoring sessions. You can reserve your spot right now by going to my website, nexusnursinginstitute.com, and reserving your spot. And while you're there, be sure to check out the audio lessons I have available on my website as well. Now, without any further ado, guys, let's get started. Health maintenance. Your patient's just been diagnosed with endometriosis. She asks you to describe this diagnosis. What is your response going to be? It's also known as dysmenorrhea. It's pain that occurs during ovulation. It's the presence of tissue outside the uterus that resembles the endometrium, or it causes the cessation of menstruation. What's your answer? Very good. So it's endometrium-like tissue, except outside of the uterus. And this is most painful when the patient is going through their menstrual cycle. Extremely painful. Very good. Which population is at highest risk for contracting tuberculosis? Is it people admitted to the hospital for day surgery, children at a summer day camp program, residents of a long-term care facility, or family who recently emigrated to the UK? Excuse me, from the UK. Very good. Residents of a long-term care facility. So any place where you have a lot of people congregating, such as residents of a long-term care facility, number one, they're already elderly, their immune system's low, now they're congregating one place. People who are in army barracks, people who are in prison, people who, let's see, army barracks, prison, people who are in dormitories, right? Any place where there are a lot of people in a small place, that's going to put them at high risk for contracting tuberculosis. Which patient is at the lowest risk for developing pneumonia? Is it a post-op patient who had local anesthesia? Is it a patient with 20-pack-year history of smoking? Is it a post-op patient who caught a cold? Is it an older patient with diabetes admitted from a nursing home? Who's at the lowest risk for developing pneumonia? I see you guys are conflicted on the live. Okay, let's talk about this. So the correct answer is the post-op patient who had what type of anesthesia? Local. I know you saw anesthesia and all of a sudden you saw anesthesia, you're like, boom. But what kind of, it's local anesthesia, so they're going to be at least risk, right? The patient who had general anesthesia, that's been lying down on that surgical table for a long time, patients not moving, they're going to be at high risk. Patients who are elderly, they're going to be at high risk. Patients who are smokers, they're going to be at high risk. But that patient who had anesthesia, but it was only local, it wasn't general, they're going to be at the lowest risk for getting pneumonia. Your patient is diagnosed with pyelonephritis. Which health problem is the highest risk factor for pyelonephritis? Is it diabetes? Is it hypotension? Is it hypoglycemia? Or is it coronary artery disease? I love you too, honey. Very good. It's diabetes. So let's talk about this. Let me tell you something. Bacteria loves wet, moist, dark, and sugary environments. That's where they grow. That's where they can reproduce the best. So any patient that has diabetes that's full of sugar in their blood, that automatically is going to put them at risk for infection, all types of infection, including, upper urinary tract infections such as pyelonephritis. Your maternity patient asks you which hormone is responsible for the secretion of milk. How should you respond? Would you say testosterone, oxytocin, prolactin, or progesterone? Please excuse my kids in the background. They refuse to leave me alone tonight. Okay, very good. Prolactin. That is a hormone for the secretion of milk from the breast. So when we're talking about testosterone, we know that's the primary hormone for the male. Oxytocin, that helps with the contractions of the uterus and even the breast tissue to expel the milk. And progesterone, that's known as our pregnancy hormone, right? But when we're talking about secretion of the milk, that would be prolactin. Guys, if you're going to stay in here, you got to keep it down. Thank you. You're teaching your patient about iron deficiency anemia. You teach them that oral iron is best when taken with what? Cola, soda, water, or tomato juice. Okay, very good. Tomato juice. Why? Here's the thing, for iron to be absorbed, you need that ascorbic acid. You need vitamin C, right? Tomato juice is high in vitamin C. You need that vitamin C for the iron to be absorbed. That's why that's the correct answer. A couple other things I want to tell you when it comes to iron administration that you're going to need to know for testing purposes. Patients taking iron, if it's liquid iron, you're going to tell them to drink it through a straw so they don't stain their teeth. It's very staining. You're going to teach them that iron is going to turn their stool a very dark color. Otherwise, they're going to freak out. You're going to teach them that iron is very constipating. So they need to drink lots of fluids. They need to eat foods with lots of fiber, such as fruits and vegetables, because it can be very constipating. If iron is given IM, it needs to be given deep deep IM intramuscularly, and you need to be using the Z-track method. Iron is very irritating, and we don't want it to seep out because it can cause staining as well. So those are some important things to note about iron. You're teaching your maternity patient about gestational age. When can the sex of the fetus be determined? When can you realize if it's a boy or a girl? Is it 6 to 8 weeks, 8 to 10 weeks, 13 to 16 weeks, or 20 to 22 weeks? You guys are all getting this right on the live. Let's see how you do on the Kahoot. Very good. 13 to 16 weeks. That's when you can, that's the gestational age you can tell the sex of the fetus. Your patient has hypoparathyroidism. You assess that the patient has a positive Trousseau sign if the patient shows which of the following responses. Is it carpal pedal spasms when the blood pressure cuff's inflated, spasms of the facial muscle when tapped below the temple, pulling up of the knees when the head's bent into the chest, or fanning and spreading of the toes when the sole of the foot is stroked? Which one is the positive Trousseau sign? Very good. So that's the one where you're taking that patient's blood pressure and that cuff is inflated. And by the way, the positive trousseau, that's a type of tetany. And so you'll see their hands start to flap like this, okay? So when a patient has hypocalcemia, one of those signs and symptoms of hypocalcemia is a tetany. One of the tetanies is a trousseau, which I just mentioned. And another one is a Chostek. Chostek starts with a C, and so does your cheek. That's when you tap below the temple and you see their face kind of go like that. That muscle irritability, that twitching that you're seeing, that is a type of tetany that we see in hypocalcemia. Okay, Professor D, you're saying hypocalcemia, but how do I know this is what's happening? Look at this patient's diagnosis. Let me move this a little bit down. Hypoparathyroidism. Let me tell you something. When we're talking about the parathyroids, what we're really talking about is calcium in the blood. If the patient has hyperparathyroidism, they're having too much calcium in the blood. So you better be thinking about all of those signs and symptoms of the patient that has hypercalcemia. If the patient has hypoparathyroidism, what we're really talking about is hypo or low calcium in the blood. Okay, so you're going to be thinking about all those signs and symptoms of hypocalcemia. You're teaching your maternity patient about gestational age. You teach that fetal movements can best be noted when. When can we note fetal movements? Is it 6 to 8 weeks, between 8 to 10 weeks, 12 to 14 weeks, or 16 to 20 weeks? When can fetal movements be noted? Okay, you guys are all over the place on the live. And the correct answer, very good, 16 to 20 weeks. Very good. Your patient had a left mastectomy with axillary lymph node dissection. You determined the patient's understanding if they say to use a straight razor to shave under the arms, to carry a handbag and heavy objects on the left arm, to take blood pressure only on the left arm, or to use gloves when working in the garden. Really, Matthew? They're live on TikTok. They're looking at you. Yes, they can. See, if I get up, you're going to call me violent. Okay, guys, the correct answer is to use gloves when working in the garden. They're laughing at me on TikTok. So that's the correct answer, to use gloves. Everyone's calling your name on TikTok. Everyone's saying Matthew. To use gloves when working in the garden. So let's talk about this. Let me explain to you why. Please get out. You're distracting me. I love you. Love you too. So let me explain to you why. So the patient just had a mastectomy, but not only did they have a mastectomy, they had a lymph node dissection. What do we know the lymph node is important for? Immunity, right? So now we know that this patient who already just had surgery, now they had lymph node dissection. We're concerned about immunity. They need to be wearing gloves when they go out to the garden. We don't want them to get infection. We don't want them to get something like toxoplasmosis. So we're going to teach them to wear gloves. Very good. You're teaching a class on how to prevent placental abruption. The nurse should include discussions about the use of cocaine, artificial sweeteners, salt, or aspirin. I'm not going to try to pronounce that long word, but that long word, that's aspirin. Acetylsalicylic acid. What's the correct answer? When we're talking about placental abruption, by the way, guys, this is a medical emergency. This happens. They're going to do a C-section, okay? What's your answer? Very good, cocaine. Now, I'm kind of concerned with how many of you guys chose anything else, such as aspirin. I just told you, I gave you a hint. I told you that placental abruption is a medical emergency, okay? This is something that can not only harm the fetus, it can harm mom, right? If you had to choose something, I would go with something that is not even There's no class for it. There's no medical reason we're going to give this, and it's going to be cocaine. Cocaine places mom at high risk for placental abruption. That's very important. You guys need to know that. Your elderly patient has been complaining of dry skin and pruritus. What do you teach may be of benefit to the skin? Is it taking a bath twice daily, using astringents on the skin, using emollients on the skin, or using a humidifier in the home? What do you guys say? Very good. Using emollients on the skin. Now, for the 34 of you guys that chose using a humidifier in the home, please explain to me how that humidifier is supposed to help with the skin. Last time I checked, a humidifier puts moisture in the air. So humidifier is good for that patient with respiratory issues, right? They got a stuffy nose. We're going to put a humidifier in that room. What's it going to do for the skin? Come on. But emollients such as creams, lotions, that is going to keep the patient's skin moisturized. It's going to help reduce the dryness. We're not going to tell them to take bath twice daily because, number one, they're elderly, so their skin is very dry. That water is only going to make the skin even drier. We're not going to tell them to use astringents. Astringents are harsh on the skin, right? And we're not going to tell them to use a humidifier. We're talking about the skin. We're not talking about their lungs. Come on. I know it's late, guys, but it's not that late. All right. What's important to promote a positive learning experience when you're teaching about the importance of breastfeeding? Is it separate the infant from the mom after birth so that the mom can rest? Mom having a history of breastfeeding in the past? A healthcare provider that encourages the mom to breastfeed? Or a positive nurse-patient relationship? Which one is most important to promote a positive learning experience when you're teaching about breastfeeding? Very good. A positive nurse-patient relationship. If your nurse trusts you, you have a positive and a therapeutic relationship. When you're teaching her about the importance of breastfeeding and all the benefits of breastfeeding, she's going to be more open to hear you out and to want to learn. You're teaching your patient diagnosed with COPD. The most important strategies in COPD education is designed to do what? Is it to help the patient become more active, to encourage the patient to join a support group, to help the patient to identify irritants in the home, or to improve the patient's oxygenation level and to decrease the CO2 retention? Okay, very good. Is to improve that patient's oxygenation level. So think about it. That patient that has COPD, whether they have, chronic bronchitis, they've got emphysema, they've got COPD. They're walking around in a constant acidic, hypoxic state. They're holding on to all the CO2, right? They're unable to expel all of that CO2. So that's why they've got the barrel chest. I can go on and on. So the point of you teaching the patient these breathing exercises, the point of you teaching the patient about sitting up and them spacing out their activities and the small frequent meals, everything we're teaching that patient, we're really trying to improve their oxygenation, because everything that they do, it increases oxygen demand, oxygen that they don't have because they're filled with so much COPD. They're filled with so much CO2, with carbon dioxide. So really all of our teaching is aimed to increasing oxygenation and decreasing the carbon dioxide retention. Now, helping them become more active, encouraging them to join a support group, helping them to identify triggers in the home. All of those are important things to do. We want to do, but the key in this question was the most important, which means if we can only choose one thing, what is that one thing that's most important for us to do? And it's really to increase their oxygenation and decrease the CO2 level. What's an appropriate goal for a patient who overeats and is overweight? Is it to create a list of food preferences? Is it to weigh themselves daily using the same scale? Is it to identify the nutritional values on different food labels? Or would it be to lose 2 pounds every week? Wow. So you guys did the same thing here on Kahoot that you're doing on the live. You guys mostly chose yellow, even though it's important to identify nutritional values of different foods. Yes, that's very important. But at the end of the day, what's the problem? Go back to the question. It says, what would be an appropriate goal for, here's the problem, the patient who overeats and is overweight. So if they overeat and they're overweight, what would the goal be? For them to lose weight. At the end of the day, them identifying nutritional values, them creating a list of preferences that you could go over with the dietitian and see which one's healthy, them weighing them scale, all of that is to do what? Lose the weight. So the goal would be losing 2 pounds every week. That is a healthy number for that patient to lose. All right. And this is how I want you guys to think when you're looking at test questions. The way that I'm explaining these rationales, I want you to think like this when you're looking at the questions and you're trying to figure out what the rationale should, what the answer should be. Okay, last question. What is the priority teaching for a pregnant patient with diabetes mellitus? Is it to test for proteinuria? Is it how to assess and manage preterm bleeding? Is it how to manage the discomfort of early labor? Or is it how to assess for signs of hypoglycemia and the treatment required? You guys have done so much better. Thank you. So the correct answer is the green one, which is how to assess for signs of hypoglycemia and the required treatment. Because the question is, what's the priority teaching for a patient with diabetes mellitus? So whatever our answer is going to be, it's going to have to do with diabetes mellitus, right? So you're not going to choose how to test for proteinuria. That has nothing to do. Matthew, are you serious right now? They can see you on the live. I saw your head. I'm sorry, guys. Listen, when I'm working from home, this is what you have to deal with. I'm so sorry. Anyway, we're talking about a patient with diabetes. So it can't be proteinuria. It can't be how to assess and manage a preterm bleeding. And it can't be the discomforts of early labor, because at the end of the day, what were we talking about? We're talking about diabetes. So it's going to be to how to assess for signs of hypoglycemia, because that patient that is diabetic during pregnancy, can they take oral hypoglycemics? Absolutely not. The only thing they can take is what? Insulin. What can insulin do? Cause hypoglycemia. What kills you faster? Hyperglycemia or hypoglycemia? Hypoglycemia any day of the week. So that's what we're going to be concerned about. We're going to teach her the signs and symptoms of hypoglycemia and the treatment required for it. Okay? Guys, if you suffered through this whole Kahoot with me, thank you so much for making it through to the end. You guys did such a great job. Let's see how you did. Okay, guys, thank you so much for watching this video. Please let me know in the comment section what you thought about the Kahoot. Let me know what kind of concepts you'd like to see me cover next, and in what format. Would you like it in a Kahoot format? Would you like it in a question and answer format that you see released every Sunday at 1 p.m. Eastern Standard Time? Or would you like it in a lecture format, like when I'm teaching out of the book? So please let me know what you thought and what you'd like to see covered next. Don't forget, I'm now offering next generation NCLEX reviews, one-on-one tutoring sessions, consultations. You can get audio lessons. All of that can be found on my website, nexusnursinginstitute.com. And almost daily, you can find me covering a variety of nursing topics on my other social media platforms, such as TikTok, Instagram, and Facebook. Thank you so much for watching this video. You guys will catch me on the next video.